Travelling in pregnancy is another thing people often ask me about, as many of our patients travel a lot, either with work or because they live in different locations. The evidence on flying seems to suggest that it's extremely safe. The only risks there are primarily to do with deep vein thrombosis. If you're overweight, older, and if your pregnancy is more advanced, and you have a family history of clotting problems, then clearly you need to be careful. But most of our women are relatively young and fairly slim and healthy, and they're unlikely to be flying late on in their pregnancy. We're happy for people to fly up until about 34 weeks, which is what most of the airlines are happy for you to do too. And where necessary, we will provide fitness to fly letters to help you to get through your airport journey without any difficulty and too many difficult questions. Now, the only other risks that there are to do with flying depend a little bit on the destination. We would advise people against travelling to places where there's little in the way of any medical care facilities. In pregnancy, you never know quite what's going to happen, and it doesn't make sense to find yourself in a difficult situation without appropriate medical cover. In addition to this, it's probably not that much fun to go to really hot countries where you might normally sit on a beach, drink cocktails, and perhaps go scuba diving, when all of these are going to be pretty unattractive later on in pregnancy. It'll be too hot, you can't drink, you can't scuba dive, and you might even feel a little bit self-conscious wandering around on the beach. So perhaps it makes more sense later on in the pregnancy to choose places that are a little bit less exotic and where also you don't need to worry about things like malaria, dengue fever, or possibly even Zika virus. So when it comes to flying, we don't really mind. We think it's perfectly safe. But do you really need to travel? Choose your destination carefully and think about where you are in your pregnancy, as the risks are going to be slightly different depending on your gestation. Early on in the pregnancy, the risk of miscarriage is a bit higher, so you might want to avoid going too far away. Late on in the pregnancy, the chance of going into labour is higher, so again, you might need to be a little careful. The only other risk that people talk about is radiation exposure, and it is true that if you spend many hours at 35,000 feet, there is a small amount of radiation exposure. This is something that's more relevant early on in the pregnancy than later on, but again, it's something worth bearing in mind if you're planning to perform a lot of transatlantic flights. Broadly speaking, it's safe, and we're happy to support you.